Hi everyone, my name is Mia Harris. I did my case presentation on osteoporosis. Osteoporosis is a metabolic bone disease that is characterized by a decrease in the bone mineral density and deterioration of bone tissue due to the loss of calcium salt. Osteoporosis increases the risk of fracture. Changes in the bone density or thickness can occur under the influence of hormones such as growth hormone, parathyroid hormones, or cortisol. Hormones such as estrogen plays a significant role in the development of osteoporosis as well. Low estrogen level or the lack thereof increases bone absorption and decreases the deposition of new bone, which occurs during weight-bearing activity. Postmenopausal women, older people, and women of Caucasian descent are more at risk for osteoporosis. It is considered a silent killer because there is no symptom until there's actually a fracture. So we'll get into the case study here quickly to keep this short. Mrs. Regan, a 75-year-old woman who has lived alone for the past 2 years. She lost her husband Bob of 40 years. She has 2 adult children that live in a different state. Mrs. Regan is postmenopausal, had a last period at age of 55. She has become less physically active since the death of her husband 2 years ago because they did everything together. She's been staying indoor a lot, and she also has been experiencing poor appetite. She's been eating less, and she also has stopped taking her multivitamins and other supplements. She has also been experiencing generalized body aches, including lower back pain with little activity. Mrs. Regan comes to the ER today after she fell to the floor while getting out of bed, and she couldn't get up due to the severe pain in her back and her left hip. She used her Life Alert device to call for help. In the ED, she complained of back pain, fatigue upon sitting or standing, weight loss, and muscle weakness and body aches. Physical exam did in fact show pain and swelling in her left hip, severe back pain, bruises, and ecchymosis on her left hip, pain and tenderness upon palpation of her lower back, the lumbosacrovertebrae. There was also some abnormal curvature of her spine with palpation. This is known as kyphoscoliosis. Her left lower leg was rotated, abducted, and shortened. Her vital signs were elevated due to the increased pain. She also experienced some weight loss as well from previous assessment. Diagnostic testing was done by bone biopsy, which showed osteomalacia. It's an impaired bone disease that is characterized by impaired bone matrix and bone mineralization. This can be caused by vitamin D deficiency. The DEXA is a type of X-ray. It's called a dual X-ray absorptiometry, which was done. It measures the bone mineral densities, and also it is done by passing high energy and low energy X-ray beams throughout the body. So Mrs. Regan's DEXA level was 2.8, which is above the normal limit, and it is indicative of osteoporosis. There was also diminished bone mass. There was diminished bone density with the appearance of a honeycomb like on the X-ray, and this is indicative of osteopenia. This is when the inside of the bone is brittle due to the loss of calcium. There was a fracture noted on the X-ray, compression fracture of the lower vertebrae, and the hip fracture was noted on the X-ray. So blood test was done. The red blood cell was slightly lower because of the bleeding due to the arterial tear after the hip fracture. White blood cell was fine. A CMP was done. The calcium level was low, which was causing her the muscle weakness, the aches and pain, and the fatigue. She also had low phosphorus level as well. The low phosphorus level is indicative of osteomalacia, the bone disease I described above. Low vitamin D level was noted as well. With vitamin D level lower causes increases in the parathyroid hormone, which leads to bone reabsorption. Alkaline phosphate enzyme was also elevated at 140, which also indicates bone disease and liver disease. So based on all of this, we can say that Mrs. Regan is diagnosed with osteoporosis, as the DEXA results show. This is not surprising because osteoporosis is common in elderly women and postmenopausal women, as Mrs. Regan fits the category. So it's also considered a silent disease until there is a fracture, and Mrs. Regan does have a fracture of the vertebrae and the left hip. So also there was also osteopenia as well noted. On her test results as well, which also is a sign of osteoporosis. Mrs. Regan was also having some back pain due to the alter vertebrae, which causes nerve pain in her back. She also has been staying indoors and avoiding the sunlight, which caused her to have low vitamin D and decreased calcium level, which led to bone reabsorption and low bone densities, as evident by the brittle bone. With the honeycomb appearance on the X-ray. So she also experienced body aches and muscle pain and fatigue, which was caused by a low calcium level. Low phosphorus level was indicative of osteopenia, which is impaired bone mineralization, as seen on the biopsy and the elevated alkaline phosphate enzyme. So that was for the diagnosis. And for treatment, so there is no treatment for osteoporosis since the bone cannot be restored to the normal level, but there are therapeutic measures that can be taken to prevent further bone damage. The patient can be treated with all of the list of medications and other therapies here. Dietary supplement vitamin D and calcium is recommended to have 100 milligram calcium, and vitamin D 800 international unit for postmenopausal women. Fluoride supplements as well. So this is all here. You can just print this out and read it, because I've gone 7 minutes into the presentation and this is just way too long. So this is that, and this is these are my references. So I'm going to attach this so you can just read it for yourself. All right, thank you.